The Centers for Disease Control and Prevention study finds fewer than 1 in 5 middle and high school students start at 8:30 a.m., the recommended start time from the American Academy of Pediatrics. Here with why lack of sleep is a special problem for teens and the impact of early school days are my guests, Dr. Rakesh Bhattacharjee, Pediatric Sleep Director at UC San Diego Sleep Center, and Jessica McCreary with San Diego County's Office of Education. And Jessica, 7:30 in the morning, I understand, is the average start time here in San Diego for middle and high school students in our county here. What determines the start time at local schools?
It's a variety of factors. There are a lot of things that will affect the master schedule in a school, particularly in high schools. We tend to see that the athletics might govern a little bit about the schedule time because there are games and practices that happen after school, and so then an earlier start time is needed so that way kids can dismiss at a reasonable time to then participate in not only athletics but the other extracurricular activities.
And what about middle schools? Is that a bus situation?
It can be. Transportation that is provided by the district needs to coordinate their transportation services with other schools in the district, and so it's hard to have everybody start at the exact same time, and that might govern what time you have to either start or dismiss.
Well, Dr. Bhattacharjee, why do teens in particular need 8 or 9 hours of sleep?
Well, there's a lot of factors that are unique to adolescence, including learning, education, physical activity, growth. Often there's a confusion that adolescents are adults. They're not adults. There's a lot of impact that they're going through. There's puberty. So from all the evidence that we've understood about children and their sleep habits, we estimate that about 8 hours to 9 hours of sleep is what's recommended for a teen.
And when they don't get that sleep, I'll start with you and come to you. So what sort of manifestations can you see, particularly in the classroom, do you think?
This is a great question. We're learning a lot about the impact of sleep restriction or not getting enough sleep on teenagers. Certainly it's impacting their abilities at school. They're not learning as well, they're not performing as well, they're not getting their homework done on proper time, but it can also impact their physical health as well. And that's something that's very new to the scientific community. What we're seeing is a lot of children have physical health issues, including obesity, that can impact how a child functions. Collectively, all of this can impact their quality of life, and they're less motivated. It can also, if you don't get enough sleep, these kids can also become depressed, in fact.
Well, what about, Jessica, in the classroom? What do the teachers say that they see, how this manifests if kids come in kind of tired?
Yeah, we'll see students coming in feeling, well, the term I tend to hear a lot of teachers say is they're dragging into school. Like you see them holding an energy drink or a coffee, and then the kids are just tired, the eyes are bloodshot, and they're sitting in their desks. And some of them do have a hard time keeping awake during a lesson, especially if the lesson doesn't engage them physically in some way throughout the lesson to keep them alert and keep them,
Well, lack of sleep is one reason, but Doctor, what are some of the other reasons, just briefly, for teens where they might not be getting enough sleep?
Well, I mean, school start times obviously are one, but we have to think about sleep hygiene as being a very common problem. Kids are not keeping consistent sleep and wake times. Teenagers are also seeing a lot of screen time at nighttime, and that helps them stay awake. These screens actually emit blue light, which can actually suppress their natural sleep drive. There are social factors that are coming into play. There's also other aspects of hygiene, which include caffeine drinking, that can also interfere with when a kid gets to sleep and stay asleep.
So taking that all into account, Jessica, is there anything that the teachers do to sort of adapt to sleepy, possibly grumpy students?
Yes, they do. There are teachers who will incorporate strategies into their instruction that get kids talking to each other, get them up and moving around the room while they're learning, maybe even walk while they're reading a little piece of text, engaging in a collaborative project with each other, and getting kids actively, literally physically actively involved in their work can help.
That'll keep them away. Is there anything, Jessica, that the schools can do or anyone can do to change these start times and make them a little bit later?
It can be done. It's a systemic issue to deal with. There's a lot of coordination of services that need to be handled, but it can be done. Lots of communication with the community, the parents, the students themselves, and the teachers to understand why this is so important to allow kids to have more sleep time. And you can also tamper with master schedules and different ways of providing the same activities in the school setting to accommodate.
All right. Well, we are out of time, so I want to let folks know there's links to this report on our website, kpbs.org. Dr. Bhattacharjee and Jessica McCreary, thank you so much.
Thank you.
Thank you.